Here in the Senate, we've started debating the health care reform bill, and there's a lot of important policy in there that's going to have a broad effect throughout our country. So let me go into the detail of that to some extent. Well, on the cost of the legislation, our best source of information is the Congressional Budget Office, and they have done an extensive review of the bill that we're considering. They've concluded that it will lower the cost, it will lower the federal deficit in the first 10 years that it's in existence, and by about $130 billion. And then the second 10 years, it will lower the federal deficit by $400, $500, $600 billion in that range. So clearly the cost is good from that perspective. The cost to individual policyholders is also very good. They've estimated that over 90% of the folks in the country who have coverage will see a reduction in the cost of their health care coverage under this legislation. And of course, there will be a lot more people with coverage under this legislation, which will also be a great benefit. Well, what this legislation does is currently the estimate is that if you exclude the folks who are on Medicare, that is the folks 65 and older, that the rest of the population, about 83% of our population now has health care coverage. That's much lower than that in New Mexico, but that's the national figure. This legislation would increase that to 94%, which is a substantial improvement. It does so in a variety of ways. First, there is a requirement on people who can afford to buy coverage that they go out and buy coverage. There's also a system of subsidies that are provided in the form of tax credits to people to help them pay the cost of coverage if their income is less than 400% of poverty. That's about $88,000 for a family of 4. And so many people in New Mexico would be eligible for that subsidy or that tax credit. And that would allow us to get coverage for a lot of folks who don't have it today. If people currently have coverage and want to keep that coverage just as it is, they're able to do that under this legislation. In fact, they can add family members to that coverage if they want and renew that coverage. But for those who don't have coverage or who are not satisfied with the coverage that they have, they would go to what we set up in each state, and that is an insurance exchange, which would be both online and an actual office of an insurance exchange. And there they would be able to compare the different policies that are being offered. All policies would have to meet certain basic requirements, and they would have to cover certain basic health services. But each individual could make a choice as between those policies as to which one to purchase, and then do that. We think it would increase the choices available to people substantially. Well, thanks again for watching, and we'll continue to update you on this in future weeks, but appreciate your interest.